what's the most critical step in management of infections? So through everything, if you don't get that tooth out, that's very important. So that's the key thing here. Your antibiotics, medical management is a band-aid. So unless you have the tooth out, you're not going to cure the infection. So that's the most critical step with that. So what kind of bacteria, is it anaerobic, aerobic, that predominate in infection? So it's really important to know when it first starts, it's aerobic. So edema, initial phases, you get a little bit of that aerobic bacteria, and then it really disseminates through anaerobic. So cellulitis through, an abscess. Abscess is really important. You're going to get that anaerobic bacteria that's very specific to an abscess, where edema and the cellulitis is kind of in between. Edema's aerobic, cellulitis is mixed. Abscess is going to really be predominated by anaerobic bacteria. Okay, next kind of question. So recognize the dental procedures that require an antibiotic prophylaxis. So, I mean, if a question is just going to be, it's going to be one that's not specific to anything that's going to cause manipulation of teeth or gingival tissue. So things that don't need antibiotic prophylaxis might be like putting on braces, making an orthodontic splint, something that you're not moving around tissue specifically. So, root scaling and planning, obviously dental surgery, root canal therapy beyond the apex, retraction cord placement, these things, you just memorize these things. So what would be not on this thing would be what you would not expect to do for needing antibiotic prophylaxis. And just be careful, because I think a lot of students, until you get in the clinic, this didn't really jive with them. So remember, there's dental infections antibiotics, and there's antibiotic prophylaxis. So antibiotic prophylaxis is for patients who have some sort of heart issue on the AHA thing, recommendations. Antibiotic prophylaxis is a little bit different than dental infection, so just also know that just clinically. All right. This is just straight up memorization. So if you're going to be asked what's a primary space infection, you just need to pick out the one. If there's a question, it's probably going to be me putting a secondary space, or putting all secondary spaces and pick out the one that's a primary. I just want you to start getting some lingo. I know it's kind of a bogus question because I'm not getting into so much the anatomy planes. Like I could make this really tricky, but I just want you to know like terminology more for charting. So knowing vestibular, buccal, sublingual, these are primary spaces. And the main thing of that, once you start getting that in your head, that's more for like what's severe, what's not severe. So someone's got a vestibular space versus a temporal space. It's going to be very different severities. So there's some background for me wanting you to know that, even though this is kind of like a simple question. All right, so let's go through. So submandibular spaces is important. So if you got a molar, like a posterior molar, if it goes below, so I had a bunch of slides, so I'm focusing you on one for a little bit of help and kindness. I know y'all are super busy, but if you had to go through all these slides, the one that's really important, the test question focuses on posterior molars, mandibular molars. So that mylohyoid line, the muscle there, if the roots are below it, and the infections below that, is going to go to the submandibular space. That's really important. And I think that's important clinically to know, because that's when the infections start getting through the deep fascial spaces of the neck and spread. So knowing the molars, mandibular molars, are important for that. So this is this question's going to focus on if you've got a patient and they have uncontrolled disease, but specifically literature has showed, no matter what, diabetes and odontogenic infections are the worst together. I mean, if someone's got uncontrolled diabetes over like alcoholism, cardiac disease, malignancy, pulmonary disease, diabetes, uncontrolled, I'm just giving that to you, is the most common factor affecting your ability to fight infection. So the next question is knowing a little bit of severity, because I think, again, that's clinically important. And I just have some comments there. So if you're given a couple different scenarios, which one's going to be the most life-threatening? And all the time it's going to be an advanced cellulitis condition. Like So this is emergent, it's hospital setting, so advanced stage cellulitis is the most severe infection you can get. And you might think, well, as you're sitting here, like, why would an abscess is really walled off. Usually they've been and if someone has literally a big pocket of pus in their neck, they've probably been doing okay, needs to be drained. But someone like this, it's really spreading fast, it's emergent, and that's just what, I'm just trying to tell you that's very important to know. So, so I just want you to make sure you would know what are the conditions you could treat in a non-urgent situation in a clinic setting. So within 24 hours, I'm gonna know this column right here. You could do a late well-formed abscess on an ASA 1 through 3. Patient's got normal vital signs, primary space, moderate pain, afebrile, edema, late well-formed abscess could be done in a clinical setting. Primary space, within 24 hours they come in, you wanna get them treated. So just, because this is honestly going to be a significant portion of your patients when you get into the emergency clinic. So I just want you to all know that. I mean, I guarantee you everyone will have a patient like this at some point in the next 2 years. And so that is why I really wanted to hone in on that question. Any questions as we move on? Okay, good. All right, the next focus is, so if a patient has an allergy to amoxicillin, and they need an antibiotic prophylaxis. So this is different than the dental infections. This is where I know students last year were like, well, the chart with the dental infections has a little bit different pathway. So you're focusing on an antibiotic prophylaxis. This is developed by the American Heart Association in conjunction with the American Dental Association. The dental infections is totally the American Dental Association. So this is their rules, their regulations. And so just know if someone has got a severe allergy to penicillin, what would you take? So again, I do have this right down here is the IV form. So obviously up here on these slides. And so I would just know this one I'm circling here. I'm not gonna put azithromycin and clarithromycin as an option. So you're gonna see azithromycin, and the other choices will not make a factor. Clindamycin, and I think that's been on a quiz question, is not the choice for this patient. That's the biggest thing. The next question, an IND, you just need to know what's the most important thing is making sure you get independent drainage. So you're not really helping someone if they have an abscess or an infection and you're not getting independent drainage. So if you're working in like the neck, the purpose of this, that's why you can't do these intraorally, because if someone's got a submandibular space infection and you make an incision in the mouth, how is that going to drain? You're going to need to go through the neck. So the purpose of just kind of this slide is knowing you need to have independent drainage. Incision is placed over the maximum swelling. Last one with infections. Now I want you to know the last column here. So I told you about the first column, and then I just want